guys, welcome back to my channel. My name is Chelsea. If this is your first time here, I am recording my week 13 through week 16 pregnancy bump date. I am a mother already to a 1.5-year-old little boy named Sebastian, and this is my second pregnancy. Just as a disclaimer, I do have a notepad in front of me underneath the camera. So if I'm looking down, I'm just trying to keep track of what I'm telling you guys and making sure that I'm covering everything that I've experienced in the last 3 weeks. Things have been a little bit crazy for the holidays, so I'm hoping from here on out that you will have a weekly bump date instead of combining the 3 weeks together. Another disclaimer, my fur babies are back here, so if you see them moving around or hear noises, that's probably them. So let's go ahead and get started. So starting with week 13, I had experienced increased nausea. So with my first pregnancy, I did not have any sort of nausea or any real symptoms that were kind of indicative of being pregnant. So the nausea is something that's really different for me this pregnancy. And it started to increase at week 13. And of course I was hoping as the pregnancy progressed and I got closer and closer into my second trimester that the nausea would decrease. In a previous video, I did mention that the doctor had prescribed me an anti-nausea medication called Bongesta. And so I had been taking that. I had backed off of it because I was feeling better, but week 13, I did start taking that again to kind of curb the nausea feeling that I was experiencing. I was also experiencing extreme exhaustion. So depending on what time we got up in the morning, I do stay home with my son. So whenever he wakes up is generally when I wake up. But about between 3 p.m. and 5 p.m. is when I really start to feel like I've hit bottom and I need to sit down on the couch and just kind of relax and sometimes take a nap depending on if he's taking a nap. But I was still experiencing a lot of exhaustion. I was also experiencing slight cramping, which I don't recall experiencing that within my first pregnancy. But I did experience that in week 13, and I wouldn't necessarily call it round ligament pain, which is when the muscles down in your lower pelvic area are starting to expand as your uterus and baby grow. So I did have slight cramping in week 13. I've also been experiencing some breakouts. So I know that I can see this one here. I did have a lot of acne breakouts in my first pregnancy with Sebastian. So I was kind of expecting it. This go around though, I have gotten the approval from my doctor to use acne medicated topical products. So like a salicylic acid face wash or benzoyl peroxide face cream. Those have kind of been what I've been using. I don't use them every day, but I have been trying to work them into my skincare routine. I know that sometimes we look online and everyone says, no, you can't use that. But I did run that past my doctor and I was given the go ahead on that. So if that's something that you're experiencing in your pregnancy, I would talk to your doctor and see what they think is safe for you to take. I do know certain dermatologists as well will prescribe acne topical medications that are considered safe during pregnancy. But my doctor has said the over-the-counter strength products are beneficial for the acne I'm experiencing in pregnancy. I have also experienced some redness and acne in my chest, which I did experience with Sebastian, as well as on my back. For those of you who have not seen my gender reveal video, which was the last video I posted, we are having another boy. I'm incredibly excited, but I am recognizing that though this pregnancy is very different, there are certain aspects of the pregnancy that I'm experiencing the same things. Something that's a little bit different in week 13, I started to recognize that I don't recall in my first pregnancy was dry skin on my back. Oftentimes I'm running over to my husband to have him rub my back because the dry skin is incredibly irritating, and a lot of the time it's in a place that you can't reach. So that's basically what I was experiencing different within week 13 than I had been in any of the weeks previous during this pregnancy. So moving on to week 14, I'm kind of going to touch on a procedure called colposcopy, which is done at your OBGYN. And I'm going to kind of explain something that I experienced during week 14. So generally when you first find out that you're pregnant, depending on the last time that you had a pap smear, the doctor will generally want to do one again just to make sure that your general health is, where it should be previous to starting the journey in your OB appointments through your pregnancy. So I did have a pap, I believe it was week 12. I did have a pap and it came back with some cells that were a little bit concerning. So at that point, they go ahead and schedule something called a colposcopy, which is where the doctor looks a little bit deeper into the cells on the surface of the cervix. And they use like a vinegar solution to bring out the cells that could be infected, precancerous, or really just causing an imbalance in the vaginal health. So week 14, I did have this procedure done because my doctor was concerned that I could have precancerous cells on my cervix, and she wanted to be sure that everything was healthy and that nothing was going to affect the health of the baby or the pregnancy going forward. So I had a colposcopy, I believe twice before this, once with this particular doctor, and I didn't feel anything different than a regular annual exam that you would get at a doctor. This process, being pregnant, was very different. So, as you probably know, if you're watching this and you are pregnant, and can relate to this, the blood flow in your body in general is a lot higher because you're producing more blood for the baby and the baby itself. So the colposcopy while pregnant was incredibly painful. There was a burning sensation for a period of time. It did subside after a while, and I did have a little bit of sensitivity after the process was complete, but the pain level was incredibly high. And the doctor explained that because of the increased blood flow to the cervix area, that it was just very sensitive. And that's something that I experienced when I had the colposcopy when I was 14 weeks. So I was still experiencing the nausea, and week 14 was actually the first week that the nausea led to vomiting. A lot of women experience morning sickness, and it can be all different levels from nausea to actually getting sick and not being able to hold any food or liquids in. I'd only ever experienced the nausea in this pregnancy, and like I said, I didn't experience nausea or any sort of morning sickness with my first pregnancy. So the fact that I got sick was a surprise to me. It happened about 3 o'clock in the morning, and it was a few times I knew it was going to happen. And for me, anytime that I feel like I'm going to get sick, there's a little bit of a panic. So it may have added to the fact that I got sick, was having a little bit of anxiety knowing that I didn't feel well. So that happened week 14, but since then I have not had any sort of vomiting or morning sickness that has gotten to that point. I will say that the morning sickness for me is more so something I experience in the evening, or I experience when I have not eaten enough throughout the day. My blood sugar will drop, and that's when I start to feel really nauseous. So I just try to make sure that I'm eating enough throughout the day, and a lot of small meals. So week 15, I actually had the first OB appointment. It was officially my first OB appointment. So I went at 11 weeks to confirm pregnancy. I had an annual exam. I had a colposcopy. And this was my first this is your OB appointment. We're going to check how your uterus is growing. We're going to listen to the heartbeat. And talk about any sort of symptoms that I was having, which I did experience a few this week as well. So week 15, when I had my OB appointment, I did speak with my doctor about getting sick. I was also experiencing headaches, and the doctor attributed that to dehydration. So with my morning sickness and nausea, the taste of water was incredibly difficult for me to swallow. And I know a lot of you are probably thinking water is tasteless, but when you're pregnant and you experience this nausea, it's the last thing you want is something that is tasteless or flavorless, though it's the best thing for us to be drinking. So anytime I drink something other than a cup of coffee in the morning and water throughout the entire day, I end up with some sort of a headache because I'm such on the verge of dehydration. So I have my Yeti here full of water with my straw. It's incredibly cold. And I actually just got this for Christmas, so I am being diligent about making sure that I'm drinking multiple waters within this 30-ounce Yeti to keep my hydration up, because anytime I have a soda, a juice, Gatorade, even sometimes when I get an upset stomach from certain foods, which I'll talk about a little bit later, the upset stomach leads to me needing to use the restroom, and anytime I pass a bowel movement, dehydration is almost inevitable for me during this pregnancy. So I really have to stay on top of my water intake, and I'd really like to surpass the point that as soon as I drink something other than water, not being dehydrated at that point. So on week 15 at that appointment, we did get to hear the heartbeat, and it was 140 beats per minute, which is right in line with the wives' tale of a boy having a lower heart rate than if you were having a girl. That's when I did start taking my anti-nausea medication again on a regular basis. The doctor, advised that I should take it until I'm no longer feeling nauseous. So at this point, I'm taking it until I'm out of it. There are certain days that I feel like I don't necessarily have to take it during the day, but I do take it in the evening because that's when my morning sickness hits. Again, another wives' tale of morning sickness only happening in the morning. And for me, that's not the case. It happens for me. It could happen any time of the day for me. But mainly in the afternoon and evening is when I start to really not feel the greatest. I did start having cravings this week, in week 15. Peaches or something I was craving, which of course they're not in season at the moment. So canned peaches have been something that I've really been drawn to, but also colder dishes. I haven't been wanting any real warm dishes when it comes to dinners or lunch or anything of the sort. Cereal, cold fruit, coleslaw, just salads, things that are just colder. For some reason, I'm not sure if that has to do with the dehydration, and my body's craving something kind of refreshing. I will say that some of the things that have been upsetting my stomach that I mentioned earlier have been dairy. So I notice when I have ranch dressing with my salad, I do end up with an upset stomach. Or sometimes when I have coleslaw that isn't something that I've made, my stomach starts to bother me, and I'm not sure if it really is the dairy or if there's just certain ingredients that my stomach is really just not pleased with. I will say during my first pregnancy, I didn't experience any of that. I didn't experience the dehydration. I could drink, soda if I wanted to. I didn't experience any sort of upset stomach. I generally have gastrointestinal issues as a whole when I'm not pregnant. And when I was pregnant with Sebastian, I didn't experience any of that. And now with this baby boy, I am experiencing, certain things upset my stomach, and I'm urgent to the restroom because of whatever I've consumed. So I do have to be careful how much cheese I'm taking in, how much dairy products, and really trying to eat more at home than more so of, eating out and eating things that I don't necessarily have the control over the ingredients. So that was it for week 15, and now week 16, things are starting to get real. So in week 16, I did experience some light bleeding. So this was 2 weeks after the colposcopy. I will say the bleeding, this may be TMI, but it was light brown in color, so that means that it's older blood, and it only happened maybe once or twice when I went to the bathroom. I did call my doctor and explained that I had done a lot of walking a couple days prior, and she explained to me that it could be something called a friable cervix. So either after the birth of my son, or with some of the abnormalities I'm experiencing in my cervix, it's considered friable, which means it's very easily disturbed with excess movement, any sort of irritation to the cervix is going to cause a little bit of swelling, which can lead to the bleeding. So we didn't really have an explanation other than I have a friable cervix, and the bleeding could have been from the extensive walking that we did around Christmas time. So I was put on pelvic rest, which pelvic rest is nothing can go inside of the vagina. So I've been taking a little bit easy with the amount of walking that I'm doing, without taking a break or sitting down, but also making sure that if I am walking around, that I'm wearing comfortable clothes and supportive shoes to help with any sort of discomfort that I would experience in my stomach, or even lower into the pelvic area, as I am starting to get a little bit rounder, and as baby grows and maybe puts a little bit more pressure into the cervix. I have been experiencing around ligament pain, which again is when the cervix starts to, the pelvic area starts to expand, to really allow for baby to come out when it's time. Back pain, my feet have been in pain and have been swelling. Those are some other symptoms I've been experiencing. So the back pain, sitting on the floor wrapping the gifts for Christmas, I experienced a lower back pain. And then Christmas Day, we hosted, so I did a lot of the cooking and was standing, on the hardwood floor in the kitchen, and the back pain, and then the feet, the bottom of the feet were incredibly sensitive and sore by the end of the day. I really was ready to sit down and just relax after Christmas. But of course, having a 1.5-year-old, you have to keep up with him and run around. But I'm incredibly grateful that I have family close and able to watch him and help when I do have these days where I have, the pain in my back and in my feet. My feet have started to swell a little bit if I'm on them for an extended period of time. If I'm standing a lot, walking around, towards the end of the day, I can realize that my feet are really swollen and I need to just kind of take a break and sit down and kind of lift my feet and relax, which is, nice at the end of the day anyway. So that was my week 13 through 16 pregnancy bump date. I will have my week 17 up the beginning of next week. So I'm going to go ahead and edit this and get this up. If you have any questions or anything that you wish I would answer or discuss in some of my next videos and my other bump dates coming forward, go ahead and comment those below. Make sure you hit the thumbs up. That's always helpful for me, and make sure to subscribe and hit the notification bell so that every time that I post a video, you're notified. So thank you again for tuning in, and have a great day. Bye.